Let's move on to the third speaker, Dr. Chunxia Guo, who is currently a postdoc researcher at City University of Hong Kong, China. And we are talking about objective and quantitative evaluation of facial masks via non-intuitive epidermal imaging systems. Welcome.
Hello, everyone. I'm Chunxia Guo, postdoc from City University of Hong Kong. It's a great honor for me to have this opportunity to give the report about objective and quantitative evaluation of cupping therapy by an indirect epidermal imaging system. I mainly focus on the application of modern technology in the objective evaluation of the curative effect of Chinese medicine. I'll report on the following aspects. Firstly, what is cupping therapy? Cupping therapy is a physiotherapy that uses the principle of negative pressure absorption to treat the local skin of the human body. The principle is to remove the air from the jar or cup to form negative pressure, which is absorbed on the body surface of the acupuncture point or the area to be congested and bruised to achieve the purpose of preventing and treating diseases. Cupping therapy has been practiced in China for thousands of years and is also prevalent in countries and regions such as Korea, Japan, etc. The cupping glass is applied to the skin, mostly to parts of the back of the patient, either by heat or by suction, commonly used to relieve pain such as chronic neck pain, low back pain, and migraine. Cupping is easy to perform, effective, safe, and well tolerated by patients, and is thus suitable for repetitive treatments. Therefore, now the ancient therapy has been used all over the world. Sorry, cannot go on the slide. Yeah. Due to negative pressure causing the skin of the cupped area to be congested and bruised, various cupping marks are formed and appeared. According to Chinese medicine theory, cupping marks indicates a level of blood and qi stagnation, toxin, or dampness accumulation in the body. The color and pattern of the cupping marks reflect the level of stagnation in local area. Generally, the darker the color, the more stagnation present. Therefore, this method of determining a patient's physical condition based on cupping marks is also considered to be a form of a traditional Chinese medicine diagnosis. However, the basic research on the diagnostic function of cupping marks is relatively backward, which is based on the use of the human visual. The diagnosis relies on the doctor's visual and subjective judgment. They may tell you there is excess dampness, stagnation, toxin, or qi and blood deficiency in your body. There are not enough objective studies to support the theory of TCM cupping therapy. Our research is to explore an objective and quantitative method of cupping diagnosis and curative effect evaluation. To demonstrate the scientific reliability of cupping therapy, we used modern optical instruments to measure local skin optical changes before and after cupping in 35 sedentary healthy subjects. Indirect epidermal imaging system, SPIMI, made by Qichang, Hubei, China, was used to collect the epidermal changes between pre and post treatment. This system developed by the team of Professor Xuefeng Liu at Nanjing University of Science and Technology. The system using the technique of photon state parametric imaging to carry out super resolution imaging and analysis of human epidermal tissue structure, capable of conducting accurate diagnosis and data analysis. Two measurements of pre and post therapy were collected throughout the course of the experiment. Data were analyzed using SPIMI system software. We chose Jianjing acupoint, which is one of the commonly used acupoints to treat soft tissue diseases of the shoulder and neck. It's located at the midpoint of the line between the big vertebra and the acromial end, and the front is straight to the breast. We used the vacuum machine with quantitative negative pressure, and all subjects adopted the same measurement standard. The negative pressure value was 0.06 ampere. That's the cup on the acupoint, and after 10 minutes, let the air out and remove the cup. Another outcome is pressure pain tolerance, PPT, which is a minimum amount of pressure that leads to discomfort or pain sensation. PPT was measured using Wagner instruments. Wagner algometer, which has been shown as a reliable method to assess PPT. It consists of 1 square centimeter rubber tip and a dial that could display the pressure of up to 10 kilogram. Algometer was placed perpendicular on the acupoint, and then the pressure will be applied until the pressure causes the pain. The maximum pressure displayed by the algometer was recorded, and changes which occur following the treatments are expected to test the hypothesis that cupping therapy can reduce the magnitudes of the pain. We also collected the visual analog scale score, which is a scale based on subjective feeling, by drawing a 10 centimeter horizontal line on the paper. It's 0 at one end of the line, indicating no pain, 10 at the other end, indicating severe pain, and the middle part indicating different degrees of pain. Subjects were asked to mark a score on the line according to their self-perception to indicate the degree of pain. Now our results, taking one of the subjects as an exam. Here is a skin appearance before and after cupping. We can see that after cupping, the subjects did appear cupping marks in the local area. The SPIMI optical system report gave a quantitative description of the 18 indicators, including fine wrinkles, pore, red zone, red spot, brown spot, color spot, etc. According to the data analysis compared before cupping, the PPT and the bar score were obviously changed, which means that the cupping therapy significantly increased the pressure pain tolerance. As can be seen from the above table, correlation analysis was used to study the correlation between red zone index and pain index post-cupping, which indicated that there was a significant negative correlation between red zone index and the pain index post-cupping. That is, the higher the PPT value, the smaller the red zone after cupping, indicating that the local tissue is becoming healthier. This is consistent with the traditional Chinese medicine theory that patients with internal stagnation or stasis will feel pain and will appear dark red after cupping, while healthy areas will appear pink after cupping. Next is a periodic observation, and in the case of one subject, this is a change in her shoulder cupping site over the 28-day period. Almost all indicators have changed, but the red zone change is most obvious, which decreased dramatically after the second or third day. And in the following week, index value decreased gradually. And then 14 days later, the values remained the same, which indicated that the value of the index does not change from the third week. Sorry. My PPT disappeared.
Could you share again? Could you share your slides again? Sorry.
Yes, I share again. It's loading. Yeah. Can you see my slide?
Yeah, we can see your screen.
Yes. Yes.
Found on my slide. Yes, this one. The trend of blood flow was similar to that of the red zones, both of which stopped fluctuating after 14 days. For these graphs shows the change in the value of collagen. We can see that there was a significant increase in the data on the first day after cupping, but the values and speed of the indicator have been in fluctuation over 28 days, and it can be assumed that the effect has always existed on the local area. These four graphs show that changing the number of collagen cells renewed over 28 days and the renewal speed in the four subjects. This indicates the first week after cupping is the most active time for various reactions within the body, and it can even affect the renewal of the stratum corneum cells on the skin surface. But in the next 3 weeks, the impact of the cupping is very small, and the indicator of the renewal rate is back to the pre-cupping level. It reflects the same results that the effect of the cupping therapy remains stable and unchanged in the last 2 to 3 weeks. Cupping therapy had a significant effect on the subject's shoulder and neck pain relief. The result of the spinning measurements showed that there were significant differences in the indicators before and after cupping. This optical system provides an objective method for the evaluation of the cupping effect. After 28 days of continuous observation, there were fluctuations in all the indicators, meaning that 10-minute cupping intervention can have the effect on the local skin for about 14 days. It is very important that we should pay attention to the safety of cupping. It's a mild trauma. We need to consider that the appropriate frequency and intensity of treatment. On this point, traditional medicine is now ambiguous, mainly relying on the doctor's personal experience and judgment. Data analysis yielded the correlation between the difference in the color of the cupping marks and the level of pain felt by the subjects. This verifies the theory of traditional Chinese medicine that the degree of pain has a negative relation to the depth of the red cupping marks. Inspired by the last experiment, we try to use a spinning system for other skin detection. For example, to evaluate the effectiveness of an innovative facial mask. Facial mask is a commonly used skincare product for modern women. Over the past few years, the demand for beauty masks has been growing rapidly. However, the traditional sheet masks have many drawbacks, mainly including 4 points, containing harmful additives, not eco-friendly, waste of raw materials, heavy and not convenient. Our team invented a water-free beauty facial mask using the technology of the unidirectional moisturizing. The mask has the effect of unidirectional moisturizing, with one side hydrophobic and the other side super hydrophilic. We also use a natural antibacterial ingredient. The hydrophilic layer can absorb water and release nutrient essence, while the hydrophobic layer keeps itself dry. Due to the novel technology and the advanced materials, the mask is eco-friendly, low-cost, portable, and convenient. Now we want to test how well it works on the skin. We designed a spinning skin test. We will recruit 30 healthy, young, and middle-aged people. The volunteers will be randomly separated into a control group and an experimental group. The following weeks, the groups will be changed over to the alternative treatment. For the experimental group, the volunteers will be assigned to apply the masks for 15 minutes. For the control group, volunteers will be assigned to apply moist towels to the face for the same period. Spinning index will be assessed before and after applying the facial mask or moist towel, 5 minutes after its removal. At present, we have obtained some data.
Sorry,
but,
Dr. Guo, we
okay.
have to impolitely stop your presentation here. We are a bit of overrun. Really sorry about that.
Okay.
So we have like time for one quick question for Dr. Guo's excellent presentation. Okay, I got one question is in your like one of experiment design, you recruit some like a subject to measure their blood flow. Maybe I missed from your presentation. So what kind of method you use to do the measurement of the blood flow in real time?
We use cupping therapy. Yes, our volunteers are mainly from students. Although they are healthy in the medical sense, many of them are sedentary and lack of exercise due to their lifestyle. So they show varying degrees of stasis after cupping, presenting the dark red color.
It's great. Thanks a lot. Let's thanks Doctor again. And